Did you know that over 40% of cancers are preventable? Even more astounding is the fact that early detection can dramatically improve survival rates, often transforming what could be a life-threatening diagnosis into a manageable condition. Every year, millions of people around the world are diagnosed with cancer, and many of these cases could have been addressed earlier, if only the warning signs were recognized. Early detection is not just a buzzword. It's a powerful tool that can save lives, and today, we're diving into this crucial topic. In this video, we'll uncover 8 critical symptoms that you should never ignore. These are subtle, sometimes easily dismissed signs that can hint at an underlying problem. Knowing what to watch for could mean catching cancer in its earliest, most treatable stages. Whether it's something as seemingly harmless as persistent fatigue or a subtle change in your skin, understanding these warning signals might be the difference between a routine doctor's visit and an advanced diagnosis. So stick with me, because this isn't just about information, it's about empowerment. Together, we'll learn how to recognize these signs, protect our health, and equip ourselves to better care for our loved ones. Whether you're here out of curiosity, concern, or just a desire to stay informed, this is a conversation worth having. The purpose of this video is simple but profound: to educate and inspire action. Recognizing the early warning signs of cancer doesn't just save lives, it improves the quality of life for those diagnosed. Think of this as a health check for your knowledge, a way to ensure you're armed with the tools you need to spot potential red flags. But before we dive in, I want to emphasize an important point. This video is for educational purposes only. It's not a substitute for medical advice or professional care. If you notice any of the symptoms we discussed today, don't panic, but do take action. Consult a healthcare professional to evaluate your concerns. Because when it comes to your health, it's always better to be proactive than reactive. Now, let's get started. Let's uncover the 8 signs you should never ignore and learn how to take charge of your health like never before. Number 1. Sign is unexplained: weight loss. If you've lost more than 10 pounds without trying, no changes in your diet or exercise routine, it could be a red flag. This symptom is often associated with cancers like stomach, lung, or pancreatic cancer. Research shows that nearly 40% of cancer patients report unexplained weight loss as an early symptom, often due to cancer cells altering the body's metabolism. While weight fluctuations can occur for many reasons, a sudden, significant drop should never be ignored. Number 2. Persistent fatigue. Everyone feels tired from time to time, but fatigue that doesn't improve with rest can be a cause for concern. This symptom is frequently linked to cancers such as leukemia, colon cancer, and stomach cancer. Unlike regular exhaustion, cancer-related fatigue can feel overwhelming, making even small tasks difficult. Studies have found that fatigue is one of the most common early symptoms of cancer, often caused by the body's response to the disease or its treatment. Number 3. Skin changes. Your skin can reveal a lot about your health. Keep an eye out for new moles, changes in existing ones, or persistent sores that don't heal. These can indicate skin cancers like melanoma. Use the ABCDE rule to evaluate moles. Asymmetry. One half looks different from the other. Border. Edges are irregular or blurred. Color. Uneven colors or unusual shades like black, brown, red, or blue. Diameter. Larger than 6 millimeters, about the size of a pencil eraser. Evolution. Any change in size, shape, or color. Skin cancers often appear in sun-exposed areas, but they can also develop in places you wouldn't expect, like under nails or on the soles of your feet. Number 4. Unusual lumps or swelling. Lumps can appear in various parts of the body, such as the neck, breast, abdomen or groin, and may indicate cancers like lymphoma, breast cancer, or testicular cancer. Many breast cancer cases, for instance, are detected through self-examinations when a woman notices an unusual lump. Not all lumps are cancerous, but any swelling that persists or grows should be evaluated. 5. Changes in bowel or bladder habits. Persistent changes in bowel or bladder habits can be a warning sign of colorectal or bladder cancer. These may include diarrhea or constipation lasting longer than a few weeks, blood in the stool or urine, unexplained abdominal pain, frequent or painful urination. While temporary digestive issues are common, ongoing symptoms require attention. Colorectal cancer is one of the leading causes of cancer-related deaths, but early detection significantly increases survival rates. Number 6. Persistent cough or hoarseness. A cough that lingers for more than 3 weeks, especially if it's accompanied by blood, is a symptom commonly linked to lung or throat cancer. Approximately 80% of lung cancer patients experience chronic cough as an early warning sign. Persistent hoarseness can also indicate laryngeal or thyroid cancer. Number 7. Difficulty swallowing or indigestion. Struggling to swallow, also known as dysphagia, can be an early sign of esophageal or throat cancer. Persistent indigestion or heartburn that doesn't respond to over-the-counter treatments might also be linked to stomach cancer. While occasional discomfort after a heavy meal isn't alarming, persistent symptoms, especially when accompanied by weight loss or pain, should prompt a visit to the doctor. Screening tests such as endoscopies can help detect abnormalities early. Number 8. Unexplained pain or bleeding. Pain that doesn't have a clear cause or unusual bleeding can be significant warning signs. For instance, blood in stool or urine may indicate colorectal or bladder cancer. Vaginal bleeding outside of regular cycles could signal uterine or cervical cancer. Persistent headaches, bone pain, or backaches might point to brain or bone cancers. One of the most striking examples of this is the case of a woman who noticed bleeding after menopause, a symptom of uterine cancer. Because she sought medical advice immediately, the cancer was caught early and successfully treated. Unexplained symptoms like these should never be ignored. Being vigilant about these 8 signs can save lives. While none of these symptoms guarantee a cancer diagnosis, they are critical indicators that something may be wrong. The earlier you identify potential issues, the more treatment options are available. Take note of your body's signals and don't hesitate to seek medical guidance if anything feels off. Awareness is your best defense against cancer. Preventive measures and risk reduction. While understanding the warning signs is critical, prevention is the first and best line of defense against cancer. Research shows that up to 40% of cancer cases can be prevented through lifestyle changes and early interventions. By adopting healthy habits and staying proactive about your health, you can significantly reduce your risk of developing cancer. Let's explore some evidence-based strategies for prevention and risk reduction. 1. Adopt a healthy lifestyle. A balanced diet is one of the most effective tools in cancer prevention. Studies have shown that diets rich in fruits, vegetables, whole grains, and lean proteins can lower the risk of several cancers, including colorectal and breast cancer. These foods are packed with antioxidants and phytochemicals that help protect cells from damage. On the other hand, consuming excessive processed meats, sugary drinks, or alcohol can increase your risk. For example, the World Health Organization has classified processed meats like bacon and sausages as carcinogens linked to colorectal cancer. Physical activity is equally vital. Regular exercise not only helps maintain a healthy weight, but also reduces inflammation and boosts the immune system. According to the American Cancer Society, adults should aim for at least 150 minutes of moderate intensity activity or 75 minutes of vigorous activity each week. Even small changes, like taking the stairs or going for daily walks, can make a significant difference. Tobacco use remains one of the leading preventable causes of cancer worldwide. Smoking is linked to lung, throat, mouth, and many other cancers, while smokeless tobacco products increase the risk of oral and pancreatic cancers. Quitting tobacco at any stage of life improves health outcomes, and resources like counseling and nicotine replacement therapy can help individuals break the habit. 2. Routine screenings, a life-saving practice. Routine screenings are a cornerstone of early detection and prevention. Tests like mammograms, colonoscopies, pap smears, and low-dose CT scans for lung cancer are designed to catch abnormalities before they develop into advanced cancer. For example, mammograms can detect breast cancer years before a lump is felt. Regular screening has been shown to reduce breast cancer mortality by up to 40%. Colonoscopies allow doctors to find and remove polyps in the colon, preventing them from turning into cancer. Pap smears and HPV tests are critical in identifying cervical cancer at its earliest stages, often before symptoms appear. Discuss with your doctor which screenings are right for you based on your age, medical history, and family risk factors. Regular checkups ensure you're not only staying ahead of cancer, but also addressing any other health concerns early. 3. Be proactive about your health. One of the most empowering steps you can take is to listen to your body. If something feels off, whether it's persistent pain, unusual fatigue, or unexplained changes, it's better to investigate early rather than wait. Many people dismiss symptoms as minor or unrelated, only to find out later that they were signals of something more serious. Trust your instincts and seek professional advice if you're concerned. Proactive behavior also includes understanding your family's medical history. If you have a close relative who has been diagnosed with cancer, you may have an increased risk. Genetic mutations such as BRCA1 and BRCA2 are associated with higher risks of breast and ovarian cancer. Genetic testing can identify whether you carry such mutations, helping you make informed decisions about preventive measures such as increased surveillance or even preventive surgeries. 4. Limit exposure to carcinogens. Another preventive measure is reducing exposure to known carcinogens in your environment. For example, ultraviolet UV radiation from the sun or tanning beds is a major cause of skin cancer. Protect your skin by wearing sunscreen with at least SPF 30, seeking shade, and avoiding peak sun hours. Additionally, minimize exposure to harmful chemicals like asbestos, radon, and industrial pollutants, which are linked to lung and other cancers. If you work in an environment with potential risks, follow all safety guidelines and use protective equipment. 5. Vaccination as prevention. Vaccines can also play a significant role in reducing cancer risk. The HPV vaccine protects against the human papillomavirus, which is responsible for most cases of cervical cancer, as well as other cancers like throat and anal cancer. Similarly, the hepatitis B vaccine lowers the risk of liver cancer caused by chronic hepatitis infections. Vaccination is especially important for younger populations as it provides long-term protection. 6. Maintain a healthy weight. Obesity is a known risk factor for several cancers, including breast, colorectal, and pancreatic cancer. Fat cells produce hormones like estrogen, which can fuel cancer growth. Maintaining a healthy weight through a combination of diet and exercise reduces this risk. If you're struggling with weight management, consider consulting a nutritionist or joining a support program to create a sustainable plan. 7. Prioritize stress management. Chronic stress can weaken the immune system and disrupt hormonal balance, potentially increasing cancer risk. While stress alone doesn't directly cause cancer, managing it can improve overall health and well-being. Practices like mindfulness, yoga, deep breathing, and regular social connections are effective ways to reduce stress levels and promote a healthier lifestyle. 8. Stay informed and educate others. Finally, knowledge is power. Staying informed about cancer risks and preventive measures not only helps protect your health, but also enables you to educate others. Share this information with friends and family, encouraging them to adopt healthier habits and prioritize routine screenings. The ripple effect of awareness can save lives within your community. By making conscious choices and staying vigilant about your health, you can significantly reduce your risk of cancer. Prevention isn't just about avoiding disease. It's about living a life that maximizes health, energy, and longevity. Small, consistent actions today can lead to big rewards in the future. Take charge of your health. It's an investment that's always worth making. Emotional appeal and empowerment. When it comes to cancer, stories of survival remind us of the power of early detection and vigilance. Consider Sarah's story, a young mother who noticed an unusual lump in her breast during a routine self-exam. At first, she dismissed it as nothing serious, but her intuition nudged her to see a doctor. The diagnosis: early-stage breast cancer. Because she acted quickly, her treatment was successful, and today she's thriving and raising her children with a renewed appreciation for life. Or think of James, who experienced persistent fatigue and chalked it up to his busy work schedule. When the exhaustion became overwhelming, he sought medical advice. Tests revealed leukemia in its early stages. Thanks to prompt treatment, James not only beat cancer, but also became an advocate for raising awareness about the warning signs of the disease. These stories aren't just anecdotes. They are proof that vigilance can save lives. Your awareness, your willingness to pay attention to your body, and your decision to act can make the difference between catching cancer early or allowing it to progress unnoticed. Your vigilance doesn't only protect you, it can also empower your loved ones to take their health seriously. This is why it's so important to spread awareness. Sharing knowledge could mean saving a life. Imagine if a friend or family member watched this video and recognized one of the symptoms we discussed. They might seek medical attention earlier than they would have otherwise, possibly catching cancer at its most treatable stage. That's the kind of impact we can make together. So here's a challenge. Share this video with at least one person you care about. Start the conversation. Awareness is like a ripple. It starts small but can create waves of change. By taking just a few minutes to share this information, you're contributing to a community effort to fight cancer through education and action. Of course, it's natural to feel anxious when discussing cancer. The symptoms we've outlined might sound alarming, but it's important to remember that not every symptom means cancer. For example, unexplained weight loss could be related to stress, a change in diet, or other non-cancerous conditions. A persistent cough might just be a lingering cold, but here's the key. When something feels off, it's better to investigate than to ignore it. Early action often leads to peace of mind, or, if needed, an early diagnosis and a wider range of treatment options. Staying informed and proactive is not about living in fear. It's about empowering yourself. It's about taking control of your health and making decisions that align with your well-being. When we talk about cancer prevention and early detection, the message is one of hope. More people are surviving cancer today than ever before, thanks to advances in medicine and greater public awareness. By staying informed and vigilant, you're becoming part of that hopeful statistic. Remember, you are not alone in this journey. Whether you're here because of personal concerns or because you want to support someone you love, there's a community of people just like you, advocates for awareness and action. Together, we can make a difference, one informed decision at a time. Let this be a reminder: your health matters, your loved one's health matters. Every step you take toward awareness and prevention is a step toward a healthier, stronger future. Spread the word, stay vigilant, and most importantly, remember that you have the power to make a life-saving difference for yourself and those around you. As we conclude this video, let's reflect on the critical points we've covered. Recognizing the 8 early warning signs of cancer: unexplained weight loss, persistent fatigue, skin changes, unusual lumps or swelling, changes in bowel or bladder habits, persistent cough or hoarseness, difficulty swallowing or indigestion, and unexplained pain or bleeding, is vital for early detection and better outcomes. Early action can save lives, so if you or someone you know experiences any of these symptoms, consult a healthcare professional without delay. If this video has been informative, please like, share, and subscribe to help spread awareness. By sharing, you're not just passing along information. You're empowering others to take charge of their health and potentially saving lives. Join the conversation in the comments. Your experiences and insights might inspire someone else to act. Together, we can create a future where cancer is caught early, treatments are effective, and lives are saved. Stay informed, stay vigilant, and remember that your health is your greatest asset. Thank you for watching, and take care.